So all these side effects of drugs, let's talk about that then. I want for you to give your final recommendations before we get to the next key. Ooh, medications. Side effects. I like it when you listen to the commercials and they will tell you about the brand new drugs and then they will say real quick, all the side effects. It's as if you take one medication and then you take more to treat the side effects. And I am one of those doctors that when my patients come to see me, I'm like, you know what, and we prescribe, and you can add to this based on risk and benefit. If a drug is going to benefit you, every drug has side effects. If you're going to have more benefit from a drug than less, we prescribe it because there's more benefit than side effects. But if you're going to have more side effects than benefit, we don't prescribe it.
Right.
So I would tell the patients, I will prescribe this drug to you, but we have a game plan. The plan is that you're going to come off this drug. I say this to all my patients, and if they are watching, they will attest to this. I said, I'm going to put you on these drugs, but these are lifestyle-related diseases. I'm only starting you on these drugs because right now your system is overstressed. I want to prevent end organ disease. I want to prevent stroke, heart attack. So I'm going to start you on these drugs, but I will take you off. We're going to give ourselves 6 to 12 months. There's a plan here. In 90 days, we're going to draw your blood work. We're going to evaluate. We're going to start taking off the drugs little by little because you're going to feel better. You're going to lose weight. You're going to get out there exercising. You're going to trust God, and you are going to come off these drugs. I instill that into my patients at the very moment I prescribe the drugs, so they know I have an agenda. Because if I don't, they get comfortable, and then they think that this is lifetime and this is going to cure them, and then they start to have all these side effects. And then some of them have come back to me where, Dr. Ruth, that drug is causing me to have diarrhea. Give me a pill for diarrhea. I said, nope. Let's just stop the drug if the diarrhea is bothersome. So what do you have to say about dealing with all these side effects? Add a drug to these side effects, add another one to these side effects.
Well, there is, risk and benefit is important, and a good doctor like Dr. Ruth will tell you about that. But sometimes we are not good patients, right? And we might end up in a situation, well, you know what, I didn't like what that doctor said, so I'm going to go to another doctor. Or it's out of our control. We go to the hospital, we get added another drug, and maybe it's been a while since we talked to our doctor, and then now we're taking 2 sets of drugs for the same thing, and we haven't really stopped to get it evaluated. So there is a condition called polypharmacy.
Pharmacy, yes.
Okay, polypharmacy is an actual medical condition where there are too many drugs in your list, and the combinations might be harmful.
Yes.
They might be in excess of what you need. So it's important to stop and evaluate with your healthcare provider if you're getting close to that.
Good. So before we move on to the last question, any final recommendations about using long-term medications for chronic diseases that are not curative?
Well, I would say keep in contact with your doctor and your pharmacist. We're here to help, right? So some common sense things you can do if you get on a medication is use it the right way, the way that it's intended, so that it will help you in the time that you're using it. Basic things. Keep the medication in the original bottle. So if you're in a situation where you can't communicate to somebody what exactly you take, or you don't remember, hey, they can look at it and say, okay, this is for this. So just keep it in the original bottle. That helps. Store it in the right storage conditions so that it won't degrade or change, and you're taking something that's not spoiled, basically.
So hold on, she's discussing the 7 keys. That's what you're discussing. This is a 7th key of living in health and wholeness, medication, therapy, how to use medications appropriately, safety. This is very important, how to get involved with your provider. This is key because we see so many patients end up in the hospital for medication abuse, medication misuse. So that's what she's talking about. So please take notes. This is key. Go ahead.
And then when you're taking any medicine or over-the-counter medication, even vitamins, if you have children around your house, if you have grandchildren, keep them out of the reach of children. We know that's a common sense thing. We don't want children to take what we're taking because they don't have a need for it. It could be poisonous or harmful. Even vitamins, too much iron is a poison for children. So make sure to keep those out of the reach of children. Don't share your medication with anybody. You may do more harm to your friend than good.
Yes.
Because you don't know how they're going to react to your medication. And if it's a controlled medication, hey, now we're getting into some legality territory, and you don't want to be on the other end of that. Okay?
And also this is, please, if there's one thing you can take from this last 2 minutes, what she just said, don't share your medications with others. I've had this happen so many times. I've had patients come to me, oh, doctor, my neighbor is taking this drug. Could you prescribe it to me? Yes. And I was sick. I was having this pain here. So my neighbor was so kind and they gave me this pill. I'm like, no, you don't do that. This is not really, this is acting blindly. You don't understand your neighbor's physiology. So please don't share medications. Don't think that if a medication works for your neighbor, it's going to work for you. Don't even think that if a medication works for your husband or your child, it's going to work for you. Each of us is created uniquely. We process medications differently. This is so important. Many people have died. Just recently, we don't have time to get into that. We have to wrap up here in about 10 minutes and we can talk more about it. She can share this testimony. Dr. Taylor was just telling me how a good friend of hers, her husband just died because of this careless mistake. The wife, who loves the husband dearly, gave her a drug, not even thinking the man died.
Right, right.
So this is serious stuff. This is serious stuff.
Okay, when you're done taking the medication and you don't need the medication anymore, just be a good citizen. God's called us to look out for others and ourselves, right?
Yes.
Don't throw the medication in the trash. Don't throw it in the toilet. It's hazardous waste if somebody else is exposed to it, or our environment is exposed to our environment. I'll just mention that in 1999 and 2000, it was found that most of our rivers, lakes, and streams, 80% have some pharmaceuticals in them, low levels.
Wow.
But we have contamination already, and that was done by the U.S. Geological Survey. So help us out. Be a good citizen. Dispose of them properly. You can check at your pharmacy for drug take-back programs. Many cities, municipalities have those. And even your waste company can tell you how to throw it away properly. Yes, you can check with check with your provider.
Somebody in the audience is asking a question, so let's hang on with the questions. We'll have time for that. Go ahead.
Yes. Yeah. So just use common sense with your medications at home. That will help them. That will help the medications be used in the best way. They will be optimal for you if you need to use them. And then, like Dr. Ruth was saying, you have a team. When you're taking a medication, you have your prescriber, okay? How should I say? I like to empower patients when I see them at the pharmacy to take care of your health. You are the best person to take responsibility for your health. And the way that you can do that is know what you're getting into. Who can help answer the questions that you need to know about this medication? The person who prescribed it, okay? So make sure that when you are starting a new medication, you want to know the name. And you may think that this is like, oh yes, of course we want to know that. How many times every day, right? How many times do I see patients at the pharmacy and we ask them, oh, what did the doctor let you know about this medication? I don't know. I don't know. Hey, this is a good opportunity to talk to your doctor. What's the name of the medication? What's the purpose of this medication? How long am I going to be taking
How long? What is the plan? Have a plan at the time the drug is prescribed. Don't be afraid of the doctor. Ask.
That's right. That's right. If you want to just make a little list when you go to the doctor, what am I going to ask? That's helpful.
Yes.
Because it's hard sometimes, depending on the health plan you're in, to get all those questions in. So make a little list. Talk about other medications that you're taking. Again, we talked about polypharmacy. And it's easier to get into than you might think. A lot of us have different prescribers. Our health plan makes us go see this person, and then you have to go see this person, and then you get a medicine from each of them. This is an area to exercise caution. So, hey, carry that list with you of your medications, and let your pharmacist or your pharmacist help you make a list. Or carry the actual bottles. Okay, that's the benefit to keeping them in their original containers. Let other providers know what medication you take.
Yes.
And if you're taking a medication that's particularly sensitive, needs particular care, you might consider getting a medication bracelet, a medical alert bracelet.
Yes, that's a good one.
Yeah, that can be helpful. Tell your doctors about previous problems you've had with medication.
Yes.
Do you have allergies? Do you have an intolerance to medication? Did you have a problem and have to go to the hospital before for a medication? Sometimes doctors don't have that in your records. It's good to know that. And then talk about what supplements and vitamins might be appropriate for you. Now, in this COVID era, supplements and vitamins have played an important role in keeping us healthy. So talk to your doctor about that as well. So be open, be honest, be willing to have an open back and forth conversation with your healthcare team.
Excellent. And I want to say something just to wrap up here about supplements. And, you know, real quick here, with supplements, we have primary use and therapeutic usage. Primary use really just means that you take it on a daily basis, more preventive to help prevent a disease. And the RDA, you know, RDA, when you get the supplement on the back of it, it tells you the dosage, like vitamin C. I believe the RDA recommended daily allowance is like 50, which is like nothing. But when the thing about supplements is something you get into the habit of taking on a daily basis, and it doesn't supplement the food. The best way to get a supplement is to eat variety of foods, because the foods provide the best supplements. If you eat well, you get the supplements and the vitamins and the minerals. And I discussed a lot of this in my teaching last year. It's on YouTube. You can go listen. So like me, I'm a vegetarian. I don't take supplements every day. There are days that if I didn't eat my good salad, then I take a supplement. Most of the days I eat great. I don't take them. So don't depend on supplements. Supplements are not replacement. You don't replace them, you supplement them. Okay? And to have them be effective is something you take every day to prevent diseases. Just to help boost the immune system, to give the body that little boost, like vitamin C. I tell my patients to take like 500 milligrams every day or 1,000. Personally, I take 1,000 every day. Vitamin D, you got to check your levels. I take that every day. Calcium. But here's the key. When you come down with an illness, those same dosages that you're taking of the vitamins are not going to be enough. You have to get to the therapeutic level here. Like when I was fighting COVID, I normally would take 1,000 milligrams of vitamin C for prevention, and then when I got attacked with COVID, I brought that up to 3,000 milligrams a day. Because research has shown us you can take up to 3,000 to diarrhea, meaning that when you start to have diarrhea, then you stop. And then I took up to 5,000 IU of vitamin D when I was fighting COVID. And then, but see, I know my level of vitamin D, so I could risk taking that much. With vitamin D, you want to make sure you get your basic level from your doctor. And then the most important thing is to know that when you are ill, you take a little bit extra of those vitamins, and you would ask your doctor, don't take what I'm saying and go do it, because I'm not your patient. I'm not giving you a prescription. This is my disclaimer. I'm not because I don't know you. I need to see your blood levels. I need to examine you to make recommendations. So this is just what I do, what I recommend for my patients, that I know them. You would have to talk to your doctor. How much vitamin C do you take on a daily basis? How much calcium? How much vitamin D? How much zinc? How much iron? And know that when you're ill, ask your doctor, how much more vitamins can I take to help to fight this disease, okay? That's very important. And then the vitamins, be careful. There are a lot of scammers out there. And I've seen patients who spend more money on vitamins than they give to God.
Have mercy.
I've had patients who come to see me. They bring a box of vitamins and they will tell me, doctor, I just spent $1,000. I said, you just wasted your money. You got scammed. You have to also understand that, please, maybe you can talk about this. The vitamins are not approved. They are not.
So yes, supplements, right?
Supplements are not approved by FDA yet or something?
Right. So they're not regulated by the FDA.
Regulated, that's the word there.
Yeah, in the way that, say, if you get Tylenol or
Yes.
Advil over the counter. When you see drug facts on the back of a medication that you buy over the counter, that means that the statements have been approved by the FDA. They've been vetted by the Food and Drug Administration. We know they're safe. We know they're effective for these conditions. However, supplements are not regulated in the same way. Those are under the Dietary Supplement Health and Education Act of 1994. So that act says that the supplements, your maybe omega-3s, your black cohosh, herbals, those things that you buy at the store, at your nutrition store, the claims for your health are not vetted by the FDA, okay? They can make something and say, hey, this is great to make you happy every day, and nobody is gonna say, well, yes, that's right, or no, that's wrong. Or these can make you strong like Superman, and nobody's gonna say, yes, that's right, no, that's wrong. That is not the job of the Drug Supplementation and Health Education Act. The job of that act is to regulate whether, if it's fish oil they're putting into that cap and it says fish oil on the label, that it is fish oil and not something else. It's not car oil, okay? So that is the job, to regulate the purity and the correct labeling of the substance in the bottle.
So all this means be careful how much money you spend into supplements. Be careful because there are false claims out there. Take it to your doctor. Just know that there are supplements to take for prevention, and it does not replace a good balanced meal. And when you're ill, fighting an acute illness, you can increase that by check with your doctor. So that is a key about supplementation. Any final comments to empower the audience before we wrap up here?
Hey, use your team. Keep open communication. You can call up a pharmacist. That's my plug for pharmacy, okay? You may not be able to get into see your doctor every day, but you can call your local drugstore any time of the day that they're open, and some are open 24 hours, and call up and talk to a professional who will help you in the middle of the night, okay? Use your team. Keep open communication with your doctor, your team at the hospital, your team at the dentist even. The dentist wants to know what medication you're on so that they can treat you effectively. So keep open communication and trust in God. He will help you through your health journey.
Amen. Wisdom. And lastly, and honestly, I didn't mention this, but this is obvious. Don't be afraid to go see the doctor. If you're doing all the things we've been talking about here, these lifestyle things, and you're still feeling or sensing that your symptoms are getting worse, it is okay to go see a doctor. Just look at the doctor as part of your team. That's wisdom. Have the doctor do some blood work, diagnostic workup to see what's going on in your body so you can know what to pray effectively about. So it's okay to see the doctor and to get regular checkups. In Jesus' name, amen. So thank you so much, Dr. Taylor, for being here. Yes. I really trust that you've been blessed by this medical information.